Good afternoon. It's my pleasure to share with you some more highlights of our portfolio targeting the ECE setting. We've really come such a long way since that 2009 summit, and it's really been just a privilege and growth experience for me to be charged with leading this effort for CDC. And personally, I'm really indebted to Bill for turning me loose in this area. Our vision for our work has benefited enormously, both our vision and as well as our program implementation, from the many great partners we have, some of which, but not all, are shown on the slide, and many are in the room. So we have two primary strategies for our ECE work. And the first, which you've heard a bit about from Ann O'Connor and Carrie, is that we assist states and increasingly now localities to adopt and implement obesity prevention standards and then support for the implementation of those standards formally into components of their ECE system. And our second strategy, which you heard some about from Carrie, is to monitor and report data on how well states are doing that, which she shared, and then as well on the ECE program facility level, how well are those facilities actually doing the right practices and having the right policies on their books, as well as the implementation. So those are our primary strategies. You've already heard a fair bit about our spectrum now, and I'm just going to mention two things about the spectrum. Most of these opportunities are very strongly interrelated in some fashion or another, and we do not attempt to capture it in the figure, in part because that would just be a big jumble spaghetti mess, but it's also because the nature of that interrelationship is a little bit slippery. It can change. It can be different from state to state, and it can change over time. But I do want to acknowledge, though, the importance of understanding the interrelationships at any given point in time in any given state or locality. The second point I want to make is so we have two strategies, one guiding framework, but we do not have our own standards. We point to the Caring for Our Children standards, which have already been mentioned, as well as IOM recommendations. And actually, so 3 points. The third point on the spectrum is that, of course, every opportunity on the spectrum plays out at all levels of the ecological model. And we try to take that into consideration as much as possible, but we do primarily focus on the outer three levels of federal, state, and local. So going back to give a little more detail on our activities for the two strategies. So for strategy one, helping states to adopt and implement standards and then support for those standards into their actual ECE system. This has really been the lion's share of our efforts over the last few years, and we've dedicated a wide variety of, we've created a wide variety of activities to support it. We've actually, to be honest, we have run ourselves ragged on this strategy over the last few years, partly as we've shifted from states just choosing to work in this area to now being required, which has been a great improvement, but also very challenging for us in terms of providing that assistance. And one of the challenging parts of that is that it stems from the reality that states are all in different places, and what best meets their needs one day may not meet their needs the next. So it is a moving target. But we do feel like one of our biggest accomplishments has been to create a fairly robust infrastructure to effectively assist and be nimble enough to meet changing needs. And it feels like our work on the strategy is sort of stabilizing, I guess, not actually peaking, but sort of stabilizing, with the exception of we're still struggling with finding the best ways to address health equity and integrate that into our work. And so I'm very eager to hear from folks in the room about ideas on to help our thinking and move us forward in that area. But we are sort of having space a little bit to step back from the strategy and really move on, do more work on the second strategy. But before I go to that, I do want to highlight some of our special projects for this one, and especially because the part of the summit is about the spreading and scale of what's effective. And I want to note that in our work, it's become abundantly clear that the best thing to spread and scale in terms of what we do is really a process-oriented approach. working with states to how to identify the critical partners in their ECE system, how to get them together effectively, how to get them to work together in a very thorough and intentional systematic assessment of what's already happened, what's been tried and wasn't successful, what's on the horizon, what kinds of resources do they have to bring to bear. At any given point in time, how can they be ready to move on what are the viable opportunities, and making sure that they can quickly shift if a window opens in another opportunity that had not seemed viable, because these things can change quickly. But that said, our focus, most of the focus has been around licensing, QRIS, facility level interventions, but we are expecting to see and hoping to see much more work on the funding and finance area, especially within the subsidy program with the reauthorization, and then of course CACFP. And I'm going to have to start talking faster. There's several, I just mentioned 4 key special projects. You've heard about some of these already, and you can hear about some more in other sessions. There are the learning collaboratives. We've done state stakeholder meetings and trainings, especially for physical activity, because that's the real requirement for our states right now. And Diane Capt, which you just met, you can speak with her. She's got a lot of lessons learned on bringing state stakeholders together, specifically around physical activity and how they do that within their state system. We have a gold knapsack pilot with Diane Ward's group. You can talk with her about it. And then we're really excited to be getting into the pediatric mini coin, which some of you will already know about, and you will hear some more about later from Karen Probert. And this map is just showing you where our work is on that. Of course, our state work would cover every map, so that's just our special projects. I'm going to go over just 30 seconds. Bill, strategy 2. Okay, the first activity, Carrie gave you a deep dive into. We're so excited for our first state indicator report, and we're eager to collaborate with partners to get better data sources for validating that for what may be a future round. But we are also super thrilled to be embarking on the beginnings of what we hope will be national, but a state-based surveillance system of ECE center-level policies and practices. What is really happening on the ground? We are poised to do a 1 to 2 state pilot in 2017, and we are eagerly exploring options for how we can do a national rollout once the time has come. And there's lots of things I didn't get a chance to talk about, but you can get them on the download box. And since I was reminded the importance of quotes, I will share the quote of my nearly 2-year-old daughter, who embodies exuberant wonder nearly every moment of her life. I did it!